does work better when you turn it on, doesn't it? Okay. I don't think I said anything that important yet. We are not actually interested in building a huge new jail for it to simply be filled up. We are interested in building a slightly bigger jail and having the possibility of expanding it quickly and easily if that should become necessary. And the input from everyone here is really important to us. We want to hear what your ideas are about a jail, what particular things you think would make a jail better, and any other thoughts along those lines. But rather than go through all of that right now, which tends to be a slow process, and we don't get very far with it, we're asking that everyone send us just a list, bullet pointed, whatever is easiest for you, of the things that you think are really important having to do with the jail. And I think if you could manage to do that by a week from Friday. Our next meeting is next Monday, but I think that's probably a little quick to ask everyone to get that done. So at the Friday at the end, or actually it could be 2 weeks after that meeting, just so, yeah, just, oh yes, Halloween, that's a good occasion for it. But because we do not want to just fill up a new jail, we need to start looking at a number of things that are in the community justice study that we had done that don't really relate directly to the jail, or some of them do relate directly to the jail, but they don't have to do with the facility itself. And one of the important things that was mentioned frequently in both reports was the need to speed up case processing, which of course is not anything that the commissioners or the council can do anything about. I don't believe even the sheriff has any control over that, but the courts, the prosecutor and public defender, this is kind of in your bailiwick. So we're hoping that you will start discussing among yourselves what can be done to speed up the case processing. And if you haven't looked at the reports yet, there's a whole lot of information in them, ideas of things to do. Both of the reports are very well footnoted with a whole lot of information, of references to, so you can look at various things and all. They also both include a lot of funding possibilities, which is really nice. But anyhow, that's something that really the case processing, if that gets sped up, then we won't end up with so many people languishing in jail. And that would be a very desirable outcome. There's also some discussion in the courts about, in the reports about the specialty courts, which you might want to take a look at and kind of think about some of those suggestions also. And then we would like for the jail staff, actually, Julie is now here. Julie, do you want to go over the recommendation, what we are hoping each group will work on?
Yes, if you give me a minute here. Sorry, I wasn't prepared for that.
I'm sorry, I sent you a text, but you probably didn't get it.
I didn't see it. I just got out of another meeting. Let me find it. Ay. Sorry about that. Can you come back to me in a moment?
Yeah, sure. One of the things that the commissioners is definitely, that we definitely hope to work on, along with the council, of course, is We hope to contract with outsiders to work on data, which we need to have some data being collected that isn't right now, and we need to have it in a more available format where we can actually tell what's really going on. And this is really very important because this is the only way we're going to be able to track to see if we've actually made progress in the justice reform part of it. So we're hoping to work with Eric Gromit and Mim.
Miriam Northcutt Bomer, who's already worked at the court.
Yeah, and Eric is working with probation.
Well, Eric's working
With the
Erica.
courts and him with probation, yeah. And we're hoping that we can get the two of them working together to kind of gather all of this information and put it together in a form where we can have a better view of how things are actually going. And Julie, if you found it, do you want to go ahead?
Sure, I'm happy to go ahead. I won't include all the questions here. I think we could send that as a follow-up email because I think it would be hard to get all of this down.
Yes. Yeah.
But the idea is that we would ask Sam Crow to conduct two different surveys, one of the jailers currently, and if you can get in contact with past jailers, great. You know, we have a list of questions like size of the new facility, things like that. And also to survey the current medical providers in the jail. For Sheriff Swain, we would ask for him to survey all law enforcement in the community, the deputies, BPD, IUPD, state police, Ellisville, et cetera, anyone who uses the facility as a law enforcement officer would need to be surveyed. We would ask the Board of Judges to survey amongst themselves with some very specific questions regarding facility size, features, and then things that they've raised in the past, such as security for a separate courtroom, and then get an opinion on co-location down the road, which is not our urgent question, but it would be good to have that. We would ask the Public Defender's Office to survey public defender office staff regarding facility space, things like communications, meeting space with clients, et cetera. We're going to need to hire, I think we're looking at maybe hiring an IU group to do a survey of current and past incarcerated individuals and their families, to ask questions about the facility and programming and family legal representation visits, et cetera. And we are going to need to find a way, and we'll need some people on this committee to step up to do this, to interview the following additional groups. And there are probably more, and if you can think of more, today would be a great day to throw those out there. But healthcare, mental health, substance use disorder care providers in the community is one. Second is local defense attorneys, and these would be similar questions we would ask the Public Defender's Office to look into. And three, the folks in the community who are actively involved in transition programming, such as New Leaf, New Life, and others. And this would be about things like facility, program space, resources, et cetera. So that's the list we have so far. And if there are other groups or entities that need to be surveyed, that would be great to hear from folks today. And we can get this list out to everyone in the next day or two. Thanks.
Just to,
Thanks, Julie. April?
sorry, I was just going to pipe up and say that the one thing I noticed was missing was the prosecutor's office. So,
Yes.
Yep, we can definitely. We weren't sure that there was going to be a huge survey need there, but I think that's great. I think can think about the questions you would want to ask and the things you'd want information on, and if you can survey your staff about it, that would be phenomenal.
And I guess that's my follow-up question. When we talk about a survey, who's determining what those questions are going to be? One, and two, how is this different from any of the follow-up that was already done in the Justice Report? And how is that going to be more narrowly tailored to accomplishing specific goals?
This is going to be focused in particular on inmates in the jail currently. And the questions, what's the group? The Indiana,
It's the Indiana Institute on Disability and Community. They have a center called the Center for Collaborative Systems Change. You'll remember that a couple of meetings ago, people were talking about surveying the correctional center. And we actually had touched base with them last year about doing a survey in the correctional center. They had taken a survey that was done in, was it Norway or Denmark?
yeah, I think it was Norway.
And they changed it for us, but we had actually had the contract written and the funding was approved, and it didn't go forward. There wasn't a lot of support from the sheriff to get that survey going forward. So as we've continued to talk with the Center for Collaborative Systems Change, over the course of several months, it became clear that they have the capacity to do some surveys and to help us out with a sort of paradigm shift, focusing on health and really sort of, it'll be a little bit more detailed and go more in depth than what I think Eve Hill did and what Ken Ray did. So it's really, the commissioners and council have agreed that they think health is a focus and health and wellness is a way to reform. And so they're looking at consulting with the Center for Collaborative Systems Change to help them sort of narrow down and pinpoint some of the health-related issues that might be going on. Is that fair?
Yeah. And basically, when it comes to the questions, I'm sure that they'll develop questions of their own, and we'll be able to take a look at them before we actually have the survey done and at least discuss whether there are more questions, different questions, inappropriate questions, or whatever. But we do hope to go ahead with this because that information will really be very helpful to us. And I think I've covered pretty much everything I needed to right now. I just do want to emphasize that for the prosecutor, public defender, and courts, case processing times is going to be something that's really important to look into. And there are a lot of recommendations about how to go about speeding them up in the report. And with that, Peter Iverson, who is here virtually, is actually going to be kind of, I guess, vice chair, more or less, of this committee. And I haven't asked him yet, but I'm hoping maybe he'll be able to start taking minutes for us. But at any rate, Peter, do you have anything you want to add to what we've said so far?
Only a cautionary note that this is what happens when you miss a meeting.
Yeah, more or less. This is what happens when you disagree. Miss a meeting. Oh,
And
okay.
I'm actually so
I'm
glad.
not hearing any better than.
I'm so glad you brought up process, because that's actually something I had a question about.
Yes.
I was wondering, for the rest of us, if we wanted to ask for an item to be on the agenda, what would be the appropriate mechanism for that?
For discussing process with us?
No, if I'd like to propose something for the agenda, because we've actually started talking about the reports again, which is, I think, wonderful. But one of the things the report does talk about is the jail, and I'm trying to understand how we'll be able to, you guys are having a planning meeting tonight to be able to talk about having it rezoned, and we received some information this morning about that, which I reviewed and have some questions about.
Yes.
So I'm just trying to understand how to get agenda items on our agenda, including transportation, which is also highlighted in the report we received this morning.
Well, we were really asking that you send us a written report about all of this. These are probably, I mean, certainly transportation is something that the commissioners and council are very aware of and have already been working on and have some pretty good prospects with it. And that's basically more our bailiwick. Although, I mean, clearly, we want to hear about these kinds of things from you because we want to make sure that we haven't overlooked anything and that we do have everyone's opinions and your thoughts about what are needed before we actually design a jail. Or actually, we're already in the process of, we've asked for RFQ, a request for qualifications from several jail developers, and are kind of moving along on that front.
Oh, so you're working on jail design already?
Yeah, somewhat, yeah. And Jeff did ask me to tell everyone that he and David Gardner had gone out to the land by Fullerton Pike that we're looking at and would like to be able to let any of us who want to go out and look at it. But apparently, right at the moment, there's a rather severe tick problem. So they're going to mow it all down, and then hopefully in another couple weeks, we could go ahead and do that.
Okay. I'd actually like to formally move then for our agenda item to either add transportation for one of our meeting topics or the size of the jail, because I believe that Mr. Cockrell shared that that's one of the first decision points, and I just have some additional information I'd like to share on that. So if I could move to add that, that'd be wonderful. Thank you.
I think we would prefer, Julie, what do you have to say?
Yeah, just a couple things to add real quick. I think the idea with these groups and these surveys is that that's where we're going to gather information about what people have to say who have various experiences with the jail currently, to get as much information as possible from as many people as possible on these very specific questions. So for example, for the Board of Judges, we currently have a list of questions which can be expanded, but the list of questions includes facility info, including size, number of cells, features, etc., access, location, security, technology needs for a courtroom, which will be included whether we co-locate or not, and then opinions on co-locating in the future, the remainder of the justice system. We just think it would be better to do it this way to get all of the input we can at one time, because if we make it an agenda item, then we're hearing it in a small group versus if we get this information out and get these questions asked and get a written report back, everybody can see what everybody's saying and what everybody wants and why, their reasons for it, etc. I also wanted to make a quick note that one of the things we're thinking of doing is something that we did when we looked at the last series of voting machines that we had approved and purchased. This is a few years back, but what we did is we had the various vendors come into the courthouse to the Nat U Hill room to set up displays, and we could go around and ask questions. And there are 3 specific vendors who build jails in Indiana. And what we're planning on doing is inviting those 3 vendors to come in with all of their information. So Angie and Jeff Cockrell had attended a conference in Indianapolis 10 days ago or so, and had seen some of this information and just wanted to say, oh my gosh, there's so much out there we don't even know anything about. And so we really want to do that and have this committee, and then perhaps the public as well, to be able to come and actually talk to these folks and look at product, look at setup, and look at some options about, things we haven't even discussed yet, to find out what's really possible. So that's one of our plans as well. Thanks.
To transportation, we have no intention of building a jail someplace that is without transportation. that is an issue that will have to get solved very quickly. At this point, we're working with the city to see, because this location is in the city limits, they could expand their bus line. There are various possibilities along those lines. We've even discussed having on this property a parking lot that could be used as a ride and share so that the buses will have more frequent use. And if we can't work something out that way, there are some other possibilities that we'll look into, but we are not, that was one of the contingencies when we made the offer on this land, is that we figure out how to be able to deal with transportation. Now, I'm sure there are a lot of people who have ideas about that that haven't occurred to us. So if you have any of those ideas, if you could send them to us in a report, we probably would want to talk to you about them further at some other time. Yeah, Catherine?
I just note that Thank you, and I apologize, I don't mean to step in on the toes of April's motion, which I believe is still pending, but I need to let this committee know that the Indiana Supreme Court issued a ruling on September 30th that says that as of January 1st, any hearing involving sworn testimony needs to be in person unless the parties agree or unless somebody can show us good cause. So I just want to make sure everyone's aware of that. Thank you.
Yes, and at the same time, the Public Health Department has become very interested in treating our way out of problems rather than incarcerating our way out of problems. And they have some new things they're working on, and for our next meeting, I think it would be a good idea for us to be able to discuss both of these initiatives that are coming up.
Thank you. I'm really thankful you talked about the transportation, because from reviewing the report that you sent us this morning on page 82, which is the second page, it specifically says there's no transit service adjacent to the site.
There isn't. No.
And Bloomington Transit has indicated that no future transit service is planned adjacent to the site. So I was just better understanding how that process worked. In addition, I know that several of us in the justice system could share that a regularly running bus, including not just every hour, especially under winter conditions when people might enter the jail in different clothing than the season that they're being released from, is something to consider. And it's not just about people getting released from the jail, it's also travel back and forth for those of us in the justice system, which would be incurred costs the county is not currently being charged, as well as transporting inmates from a non-co-located justice building to a jail, and that's additional costs that the county's not currently incurring. And I was just wondering if that is something that you're considering right now and evaluating the cost as you decide how big of a jail to build.
Yeah, it is. We've been talking with Bloomington Transit and have actually heard something somewhat different from them. And we, as I say, you know, we recognize the importance of transportation, and we'll continue to work on that until we've got something worked out for this. And as I say, if we cannot work anything out with the city, then we do have some other possibilities that we don't want to really look into right now. But we realize that the county is going to incur some costs for this, most likely, because at this point the city is talking about some sort of charge for a line to the jail. And it just may incur costs for us. Darcy?
I'm wondering, and I don't want to derail any non-agenda or agenda that we had, but I'm wondering, not only getting people to and from the jail, but have you guys thought about how it's going to happen to transport inmates back and forth, you know, from the jail to the courthouse, since right away we're not going to co-locate? Because there are some offenders where it takes, even from bringing them upstairs to downstairs, it takes 2 jail guards.
I think this is something that Sam will probably advise us about and work on. That's more his area of expertise than ours.
I thought with the approach, though, was more collaborative. I guess that's what I'm trying to understand, what our goal is as a group. If we're trying to each bring our individual experiences and perspectives and work together to share them. Like you guys shared this, the Bloomington Plan Commission staff report, which I really appreciate. It helps me become better educated and make better recommendations. But if we're going to work collaboratively, I was wondering if we'd have some of those discussions together.
I think that where we are more or less heading now is the fact that, I mean, as I say, we want everyone's input, we want your ideas as individuals, but ultimately it is the commissioners and the council who are going to be responsible for the jail. We're going to have to make the final decisions, no matter what. So we certainly hope to get everyone's input, but what we're really hoping is that we will fairly quickly get the jail dealt with, because we don't have a lot of time with this. And this group is really intended more to work on things that are needed in the community before people ever go to jail, which may not really involve many of you very much, but also how people get released from jail, what sort of services are available to them once they're released, and those kinds of things. And of course, Sam will be quite involved in that also. Does that answer your question? I wonder, Margie actually has...
Yeah, oh no, I was just making some notes. Yeah. Yeah, can I share my slides?
Yeah, Margie has put together a number of slides that kind of give background and tell more or less where we're at. And if she could show those right now.
I'm going to share my screen. Okay, so let's see. And I don't know. Okay, I'm going to go through these slides. So today's the 10th. You guys were all at the last meeting, which was sort of frustrating, I think, for everybody. Oh, wait a minute. What's wrong with this? Hold on, that's not my slide. Hold on. Let me get to this. Okay. I don't know why that's... Okay, we'll go to that slide. I don't know why those extra slides are there. Can you guys see that very well?
Not really.
TSD? I don't know.
If you start your slideshow.
I thought I did. Hold on. This could be, hold on, let me get to it. Did the slideshow. Dismiss. There we go. Thank you. Okay, so let me jump to this one. So just a reminder, somebody asked at the last meeting, they said, I don't even know why we're here. What's our mission? Well, the mission of this committee, the mission of this committee, as Lee just said, was to sort of look at intercepts 0 and 6 of the sequential intercept model. But I thought it might be helpful to start back at the beginning. When the county did criminal justice studies, and they did those a couple of years before the reports came out, COVID hit and sort of slowed things down. But the idea was to review and reform the Monroe County criminal justice system in order to positively affect the Monroe County Correctional Center population, the community, and to reflect Monroe County values. So that was a mission that came up with judges, the prosecutor, public defenders were there, commissioners, council members. And at that point in time, we've been under a private settlement agreement for decades. The ACLU had sued Monroe County years ago because of poor conditions in the jail. That private settlement agreement was ready to expire, and Ken Falk was ready to dismiss it. That private settlement agreement is what puts the cap on the number of people in our jail. So Ken Falk called the county attorney's office. He said, we said, we'd like to actually keep it in place. We don't want it dismissed. which is kind of an odd position for the county to take, but the sheriff and the commissioners were like, yeah, we kind of like having it in place. It keeps a lid on the jail. Let's keep it in place. And he said, I'm not going to do that unless I get a tour of your jail. So Ken Falk and I toured the jail. Sam Crow gave us a tour, and he's like, it's a lot better than it was. It's quieter, it's cleaner, you don't have people sleeping on the floor. However, you still have the worst designed jail in the state of Indiana. And I think you need a new jail. And the commissioners said, let's get everybody together and decide whether we in fact need a bigger jail or whether there's something else that's at the root of the problem. Perhaps our case processing times are slow. Perhaps people don't need to be in the jail. They need to be somewhere else. So let's look at this. So those studies were done. As you know, Eve Hill's report came out in April of 2021. Ken Ray's report came out in June of 2021. So the reports were submitted by the consultants then in April and June of 2021. In August of 2021, a committee of only commissioners and council members were created. So there was a 5-member committee. Fast forward, May of 2022, they hired the first facilitator, that's me, to work with the council and commissioners. So you can see there was a gap in time. I think they tried to meet, they tried to hire a facilitator. They put out a description for that, had HR try to hire somebody, and had no luck. So they approached me and said, will you do it? And I originally said no, not interested. I've left the county. I'm not a facilitator, I'm a lawyer, and I actually don't think I'm the right person for the job. They're like, no, actually, everybody, I think that'd be great if you could help us. And so I agreed to do it, talked with the presiding judge, talked with some other people, and here we are. So in August of 2022, the committee got expanded to add the prosecutor, add the public defender, add the judges, and add the health department. And I had thought originally, back when I was a county attorney, when the reports came out first, that there needed to be this collaborative group of people. Because, as you know, the judges have a lot of discretion, the prosecutor has a lot of discretion, the public defenders have a very important role, and I think the health department has an important role. Because many of the state of Indiana is recognizing that many of the people in our jail are addicted or mentally ill. And in fact, there's going to be a conference, the JREC's having a conference on that later this month. So the committee got expanded, and as we've been working through things, the council and the commissioners have decided that health and treatment should be a focus. That's been prioritized. I think they've talked with the health department, they've talked with others in the community, and people are saying health and addiction are areas that the county should focus on. And if anybody, if you haven't already taken a look, there's this Indiana Behavioral Health Commission report that was just issued in September of 2022. It's got some great information about the health and wellness of inmates and sort of focuses on that. So, again, here's just a little history. That ordinance was passed in August of 2021 to create that first commission. 9 months later, a facilitator was hired. It's my understanding that there were sort of intermittent meetings in between that time. We held meetings June 1st, July 6th, and August 3rd. We did not hold meetings June 22nd, July 20th because there wasn't a quorum. And then the commissioners amended the ordinance to add everybody else in August. And we renamed that committee the Community Justice Response Committee because as Judge Stafford points out, it's really not just criminal, it's also civil. And we really should be looking not at just criminal issues, but many people who are in the system, whether that's civil or criminal, are probably not living their best lives. If you're in eviction court, you're in small claims court, you're deserving of justice. It's a civil case, but you're deserving of justice. So committee's been renamed. Again, just a little bit of background. For those of you who weren't here early on, who got, added, you know this, but again, we've had the Community Justice Group has met, just a few times, and we've really had 3 meetings as this group. So what's next? The commissioners and council are deciding that they're going to co-lead. So as Lee pointed out, Peter is going to be a co-leader of this committee. They're going to focus on health and treatment. They're going to assign tasks to subgroups, which is what Lee was talking about, asking for information from you guys because we only have an hour and a half together twice a month. And so they think it'd be more efficient to have some subgroups working. We tried to touch on that at the last meeting, but People couldn't decide whether they wanted a subcommittee now, later, or never. And so the commissioners thought, yeah, subgroups would be a good idea. And they're also going to explore a partnership with the Center for Collaborative Systems Change. And that's an important feature. So again, Eve Hill reports and Ken reports that clarity and leadership is needed. In fact, Eve spends a pretty good portion of her report talking about one of the first committees that needs to be put together, and it's a infrastructure committee, leadership, community support, and coordination. And so the commissioners and council are going to step up to the table because the role, mission, and focus, as last meeting's was clear. It's not clear, it's not understood, it's really not been agreed upon. People are wondering, should we talk about facilities? Should we talk about transportation? You know, how are we going to do this work? You know, basic processes such as whether we should form subcommittees or not hasn't been determined. But the commissioners and council strongly agree that health and a treatment-oriented focus is important, and they have that authority to lead the creation and the funding of those programs and facilities. So statutory roles and functions need to be understood, as Lee was trying to point out. The commissioners are the executive and the legislative body of the county. The commissioners get to fund. They're going to take those. Council's going to fund. They're going to take those roles seriously, and they're going to, you know, when they need information on other items, they're going to assign some tasks and ask for reports. I believe that communication and transparency and a public-minded focus have to be prioritized. There have been some things that we found out at public meetings, like we had an agenda item the last time that was, hey, should we co-locate or not co-locate? And then we found out from Jeff Cockrell when he showed up to the meeting that the money isn't there to co-locate everything all at once. And so that kind of information should be shared publicly as soon as it's possible so that we don't waste time. We have had ideas before about having surveys and having public input on the website. That's not yet been determined. It's not yet been done to get that public input on the website, but I would argue that it's important to do that. Again, leadership, collaboration, and having that infrastructure to really carry this work on indefinitely is going to be important. And the commissioners and the council, along with the health department, are going to lead in this sort of health-oriented focus. Everybody knows that you guys have a lot more statutory authority than what's up here in a couple of bullet points, but essentially, I think it's going to be important for everybody to think about what they can do and what they have the authority to do, rather than what they can't do or what they don't have the authority to do. So the commissioners get to approve all contracts. That includes the jail contracts, the jail service contracts, those phone contracts, the advanced correctional health care contract. They are also in charge of all buildings, and they have to maintain a jail that's specific to the commissioners. Everybody likes to say it's the sheriff, but the commissioners actually maintain the jail per this code. The county council approves all funding. If there's any conveyance or acquisition of a property over $1,000, the commissioners have to approve that by ordinance. They also get to determine the number of jobs, the job descriptions, number of employees, all of that. The Board of Judges obviously manage their unified court. They report to the state Supreme Court. They do not report to anybody locally. And they issue, if there's a criminal sentence or a civil order that's going to be issued, it's done by the judges. Prosecutor, and these again, I know you guys have a lot more statutory duties than this, but this is like very simplified. The prosecutor files and dismisses any criminal charge and offers the plea agreements, or they prove those at trial. And some of this is for the public as well. The sheriff pursues and jails felons, is what state code says, and they take care. The sheriff takes care of the jail and the prisoners. Also, there's a statute that says they're supposed to file weekly reports with the court and the prosecutor, and an annual report to the commissioners, and CM does that and gives it to the auditor. And there is a lot of data that the code is pretty specific about what those reports are supposed to include. So the jail commander works underneath the sheriff, follows these statutory guidelines, and he works with outside contractors, but those contractors have to be approved by the commissioners. Obviously, the public defender represents indigent persons, negotiates plea agreements, and reports to a certain board of directors. The health department administers, supervise their staff, and the administrator reports to a board, and they exercise delegated authority of the state of Indiana. So when Lori's working, she's actually exercising the state power, and has a great relationship with the School of Public Health and other outside entities. They're pretty great about getting grants as well. Okay. So again, I'd like to just point out a few things in Eve's report. She said that there's a publicly stated commitment, but sustained leadership and coordination hasn't yet been figured out. And again, really that's in 37 through 44 of her report. And that's something that she shared with me as well, individually in many conversations, is that because this is nobody's, this isn't anybody's job, somebody's got to step up and do it. And I think the commissioners and council are telling you today that they're going to step up, work together to get that done. That report that I mentioned, the Indiana Behavioral Health Final Report, it mentions that addiction and mental illness are health concerns that require treatment rather than incarceration, and that 25% of people in jail report experiencing serious psychological distress. There was a presentation that Bliss McKnight, who are municipal insurers, gave at a AIC conference, and David Potteroff called me afterwards and mentioned, he's like, I wish you would have heard this, because they essentially said, you're going to have to treat your way out of this problem, you're not going to incarcerate your way out of this problem. And I've got those slides to share with the commissioners, to share with you guys. But they estimate about 40% of individuals who are incarcerated have a mental illness. There's a state report out there that says the cost of untreated mental illness in Indiana is estimated to be $4.2 billion every year. And that commission report again acknowledges that the long-term goal should be to prevent as many individuals with behavioral health challenges from entering the system in the first place. We don't want ill people in the jail if we don't have to have them there. We want them somewhere else. So the commissioners are going to formalize some partnerships. They understand that they can't do this on their own. These are community-wide problems that need community-wide solutions. There's going to have to be a hybrid model, and the county's going to have to explore how to develop interlocals and MOUs with some of these community partners. I believe the commissioners need to negotiate, and the council should fund a contract with the Center for Collaborative Systems Change. Allison Howland, who's the director of that, and she's got a co-director now. Her name is Maggie Walsh-Buhai. She has a public health background. Her husband happens to be the chair of the School of Public Health at IU. They're very interested in working with Monroe County. Lee has met with them on a Zoom call. They believe that, and I'll show you a little bit about them here in a minute, but they believe that they can really work with the county and engage some of the best research at IU, including the researchers that the courts and the prosecutor are already working with, Peter Finn, who's in the School of Psychology and Brain Sciences, and pull together a collaborative team from the university that can work with this collaborative team at the county and really develop that infrastructure that's going to be needed long-term to move this committee forward. Things like working with the School of Public Health, the School of Criminal Justice, and those to really do some great collaboration. IU also happens to be thinking in their strategic plan, it hasn't been formalized, and I haven't found it publicly yet, but I know that they are working to improve health outcomes through their own research, through community service, through partnerships, and engagement. And so the timing seems to be right to work with IU. So again, next steps and goals: to focus on reform and public health as a means to a safer community, to partner with IU, to focus on developing and providing medical treatment for people with addictions and who have mental health concerns. And this is something that Lee touched on, to collect and analyze data in an integrated manner and reveal that on a public dashboard. So a lot of those statistics that the jail's already supposed to be keeping statutorily could be put on a public-facing dashboard. You could see how long cases are taking to go, 0 to 90, 90 to 180, 180 to 365, over 365. You could see at any day and time how many people we have in the jail. You could have breakdowns of the kinds of charges. all of those sort of stats that are being collected already could be shown publicly, kind of a public report card, if you will, to say sort of how we're doing. And that's something that I think the commissioners have the authority to do under contract and are really interested in, because all of this work that we're doing is being paid for with public dollars, and so the public should sort of know how things are going. So, timeline going forward. The timeline, as we said before, is to secure land and for a building of some sort by December 2022. Now, I know Lee has talked about today about building a jail on that site, and the question is, in my mind at least, do you build a jail with treatment, or do you build a treatment center that happens to have some secure beds for those people who need that kind of security, for the judges to be able to order somebody to a facility and feel like they're going to keep this public safe? Again, how do you build that? Do you build one roof that has the security and one roof without it, with a sally port in between? Those, to my knowledge, that has not yet been decided. That's right. That's why you would get an RFQ.
Yeah.
Yeah.
And we haven't even really, we probably do need to build a jail, an actual jail. It's just that when you get beyond the violent criminals, are there other ways to deal with them?
And what does your jail look like?
Yes, and also what the atmosphere of the jail will be.
So you mentioned probably need to build a jail. Can you tell
I'm sorry, I can't hear you, April.
Sorry, I'll get a little closer. Is that better?
Yeah.
Okay. You mentioned we probably need to build a jail. Is that because you're unsure at this point as you sit here?
There could be, if what we're talking about really worked, what would happen is a lot of people would no longer be in the jail who are there now.
And where would they be?
Well, that's what we haven't yet worked out, whether we would actually build a new jail or attempt to remodel the jail we have now. I think to me, it seems much more likely that we'll build a new jail just because the condition of that building and the design problems that we have with the jail and all really need to be remediated. So,
But, I think Sam's the one, I know I've heard you and the sheriff, when you make your budget presentation, you say we're the largest mental health provider in the county. And you say 80% of our people in our jail are addicted or mentally ill. I remember Judge Kellums used to say 100% of the people in the jail were addicted. So if you have that many people who are addicted and mentally ill, the question is, what type of facility is going to best meet their needs? Obviously, the judges have to feel comfortable sending somebody to a place where it is secure enough that they're not going to hurt the public. And so nobody here thinks that you're not going to have secure facilities. You're obviously going to have a secure facility for the number of people that need a secure bed.
So tell me how that impacts your request this evening for rezoning and the 10 million.
hear
Can you help me understand then how this is actually new information, so I'm glad you're sharing it. Previously, when we talked about whether or not there would be a remodel or a new jail, it was very clear during those meetings that your position was a new jail. And from reading your zoning request, you're specifically asking for a jail, which I understand the property is $10 million. In addition, for a bond, we're talking about another $50 million. So that's been all of our understanding up until now. I'm just trying to understand where we are, especially when you're having a zoning meeting tonight with a request for a jail.
the zoning meeting isn't really relevant. I mean, the zoning meeting is relevant as to whether or not we can use that property. But that's most of the problem there. And as I said, we determine exactly what kind of facility we're going to put there. And we'll work with the city on transportation and other things.
Okay, so...
And it's an industrial zone, so either a mental health facility or a jail or a hybrid type facility could be built at that location. And the meeting tonight is simply to say, will you rezone it so that those types of buildings could go there? Then once that gets approved, as Lee said, they would have, start working with designers, bring them in for people to look at and sort of interview, I think, to determine then what kind of facility.
I think when we're actually working with the designers is when we really want to have everyone's opinions and discuss with the designer what we can accomplish and what we can't. Of course, we're also going to have to look at funding and see what we can afford and what we can't. Although it does sound like there may be some funding becoming available that hasn't been. And although, well,
there is going to be, I mean, so part of the lure of working with somebody like the Center for Collaborative Systems Change and the conversations that we've had with them already is that they're identifying funding sources for this, idea of, yes, we have a lot of people who have committed criminal acts, but they happen to also be addicted and or mentally ill and in need of treatment. And, we're hearing a lot of information from the state here. I think we'll hear about it at that JRAC conference later this month, hearing about it from the FSSA when they're going to hand out the opioid settlement money that's coming through Becky Booner's office and Doug Hunsinger's office. And they're going to survey counties to determine what they already have in place before they churn out the opioid money. And they're also, when I said, well, we'll check every box, I'm sure. And she said, well, we're going to make you back that up with data, which comes back to the need for data to sort of back up what we already have, what's working, what's not working, where we need to fill in the gaps. So if you look at this, you can see that this is, we're not yet at December 2022. The land is going to be secured hopefully by the end of this year. And hopefully by the end of this year, the county will have that partnership with the Center for Collaborative Systems Change formalized. Then in 2023, begin designing the facilities, the programs, and developing those budgets. One of the things to remember is that, and Peter is on here, and Peter can jump in at any moment in time as a council member, or Kate, or any council member can jump in here, but the county council really starts thinking about budgets, even though you typically see them dealing with it in the summer. They're talking about it 12 months of the year, and they're already starting to think about things like, if we shift more money to the health department's levy, what does that do to everything else? How do we properly fund, if we are funding you guys, let's say at the same level we're funding you guys, how do we increase the health department budget if the focus is how to really go at this from a public health standpoint and in fact treat people who are sick as sick people. So that's going to start in January, sort of to thinking about those budgets, and then hopefully take a year. By the end of next year, by the end of December 2023, you should see some of those partnerships, some of the programs, and the facilities really formalized. Oh, hold on, I disconnected. I don't know. My slideshow went away. TSD. It said I was disconnecting, and I ignored that.
Can I ask a question?
You can.
So in the beginning, Commissioner Jones said she wanted us to send a list of what we wanted or needed for a new jail, and then we were also talking about a survey. Is that the same conversation, or are these two different conversations? I can clarify too.
I think it's a different conversation.
Okay.
It's survey what I guess you call stakeholders.
Okay.
And hear what their opinions are. And I guess we're kind of surveying you, asking you what your opinions are, what you see as being really important.
Okay, and then just so I understand, that you want us to send you the list of sort of our requests, I guess, by when?
2 weeks from Friday.
Halloween.
Yeah, Halloween. Yep.
Okay. Okay.
And those, you're going to generate the questions that you want all us to answer, is that correct?
No, well, when we're surveying other people, because you are more knowledgeable about the jail than we are, it wouldn't make much sense for us to formulate the questions. we want to hear what your thoughts are. What you see as being a good new jail, what kind of processes you're interested in, features of the jail you might be interested in, all of those kinds of things.
And I'm sorry, since we've had this report, going back to the report and your presentation, Ms. Rice, thank you for the next steps section. I didn't see anything in the next steps addressing the jail. And if we're going back to the report, I think it was pretty clear that it cannot maintain constitutional standards of care and that we have people in that jail right now. So we're talking about planning, but half of us are going to go back to work tomorrow and have to make some really difficult decisions, keeping in mind justice and keeping the community safe. And I care about every single person in that jail and the people who are working in it. And so I just want to know what we're doing as a group, next steps to address these constitutional concerns. One, and two, what weight are we going to give the data that's already included in the report that we received over a year ago, starting on page 80, 81, 82, and 83, regarding bed size?
I think the answer to that is that the commissioners are going to take the lead on the facility. So they're going to ask for your input on the facility, but it's been proven that since we've been meeting in this large group that we haven't made much progress on the facility. And I think the commissioners, correct me if I'm wrong, the commissioners and council, because they're in charge of the facilities and the council's in charge of funding, they're going to separately sort of lead on that and ask for your input so that they can factor that into their decision making. Is that right?
I think that's a pretty accurate explanation. Peter, Kate, Julie?
I mean, that's our responsibility, as you outlined,
Yeah.
but I wasn't entirely involved in kind of framing this approach. I wasn't involved, but
Yeah.
so I would, I've been out of town.
You were out of town,
Yes.
yeah.
No one's fault but my own. I would, though, suggest that perhaps even questions as vague and ambiguous maybe as you feel what you just said might be, those would be important to share, to structure whatever conversations they're having.
Yeah.
So, because I'm a little unclear on what suggestions for the facility might be.
Right. If I
mean,
ask,
that's
Well,
huge,
that's some of why we aren't being specific, is because we're rather unclear about that. So basically, we formed this group wanting to be able to work collaboratively with everyone, but it's turning out to be a really slow process, and we don't have that much time. As you say, you care about everyone in the jail right now. We want to be moving on the jail quickly. The rest of this report doesn't really have anything to do with the jail. Well, in a way it does, but when it comes to the actual facility, that's what the commissioners and the council do.
So I think I'm clear on your answer. I was just trying to understand how we could work collaboratively to share information with you, because I totally agree. I believe in transparency, and I'm willing to have these public conversations with some of the challenges that we're having and some things that are going to happen if you don't co-locate these facilities. And I'm just trying to share them with you in advance so that we can plan for those challenges. It
Well-
just sounds like you don't want input on the jail until you let
When
us
it
know.
comes to the co-location, that's actually something that we would very much want input on. You all would have a much better idea of how that would work than we would. But at this time, we know that we don't have the money to do that. We aren't talking about co-location immediately. We're talking about putting a courtroom, or maybe more than one courtroom, depending on what we can afford, with the new jail. And then we'll start looking at the co-location.
Okay. So could we talk about in one of the meetings either transportation or the size of the jail? Because I think that's one of the challenges we have when we talk about making progress. We have a lot of agenda items because it's a big topic, but if we stuck to a specific item and maybe had an agenda in advance, like some of the data, the information you're providing us right now in the middle of this meeting, if we could have that in advance, I think we might have a more productive conversation.
I think
Peter's got his hand up
Yes,
too.
Peter, please.
Peter?
I had a question in addition to what's being asked. So if you want to answer that.
There's a little bit of a lag, Peter. Can you try re-asking your question or maybe type it in the chat?
Are you able to hear me?
Now we can. Yeah, go ahead. Try it again.
Yeah. Is there still the lag?
It's much better now.
All right. How about now? Are we good?
Yeah.
Okay,
Well-
good. My question is to the commissioners. Twice today, we've heard that we're under a great deal of urgency. And my question is, are the commissioners in agreement with the agenda that was shared, the timeline shared today, or is there a more urgent?
The timeline that we shared is probably ambitious even right there. You know, this is what we'll aim for. It is, one of the reasons it's urgent is because the jail is unconstitutional. Margie has taught us all about this. At any time, the feds can come in and tell us that we have to build a new jail. This actually happened in Vigo County, and they aren't very happy about it over there. The feds are likely to determine the size, the design, a number of things like that. And we, by moving ahead with the process, we can prevent that from happening. So it's urgent that we actually be doing something. We would very much like to follow the timeline that we've suggested. We are aware of the fact that it could be a bit ambitious, but if we don't try, we won't find out if we can do it.
And I want to, for those of you who may not be familiar with the Center for Collaborative Systems Change, and why it's an important group, I think, for the county to work with. Their focus on empowering communities to maximize their strengths, improve environments so that all individuals, children, and families are safe and supported. They approach research and evaluation in partnership with communities to build local capacity that fosters lasting, sustainable change. Many people I've met with in the community since I've been working on this have ended, whether that's with CASA or people within the system or people outside in the mental health realm, believe that we might know we made a difference when those kids that are chins now are not in jail in 20 years, or the people that are in jail now, their kids are going to be thriving and well. And so the idea of focusing on research, focusing on data, focusing on public health, focusing on collaboration. The best thing about county government is the collaborative design, where everybody's given a little bit of piece of the authority. Like the commissioners build, the councils fund, the courts handle the processing of cases along with the prosecutor and public defenders. The worst thing about county government is the disjointed design where nobody has all the authority. And so in order to build any building or pay for any program or facility, that requires the commissioners and council to work together. They regularly have said, well, we don't do anything in the justice side of things. We don't do anything with filing cases or defending cases or processing. None of that is us. And that requires the courts and the prosecutors and the public defenders to, the sheriff and jail all sort of work together. And so I think what Lee is outlining today is an approach where you guys will, who are experts in your field and in your areas will be able to give input to them as they have to make the decisions on the buildings. And the question is, when everybody sort of like, we're going to build a building, they're going to buy land, there's going to be 90 acres there, what does that look like? And I think Lee's being honest right now, she doesn't know what that looks like exactly. But certainly if you have a bunch of people who are ill, who are addicted, who are mentally ill, they need treatment, and we're going to have to figure out how to step up to the plate and provide that treatment. And in what kind of facility does that look like? Regularly, people are, as the state points out, if you talk to some people at the state, or Ken Falk, who sued the state of Indiana for not having enough mental health beds, they don't want sick people put in a cage. They want sick people put in a secure facility if they need security, and they want them to be given treatment. Now, I attended that same seminar that Angie and Jeff attended. I attended online. It was the Paul E. Jail Building seminar, and there were people from the Department of Corrections and mental health there. There were all kinds of vendors who say, we've got this sort of furniture, we have these sorts of locks. We can build this kind of facility that doesn't look like a traditional jail, but it operates like a traditional jail. And the state's very interested in health and wellness and treatment. So that's the focus. Now I want to tell you as well, so that's the timeline, and as Lee says, this is an aggressive timeline. Buying the land, hopefully they can get that wrapped up in the next few months, and then by the end of 2023 have the funding pieces in place, the partnerships in place, the designs in place, and then in early 2024 begin construction of what that looks like. I use construction in quotes because that might be constructing an actual building, it might be constructing programs, but you're going to have your relationships in place. I can tell you here, the next 3 slides, and we'll make these slides available, are some of the people that have been our contacts, our partners that have been communicated with since May and who are interested in stepping up. That's YSB has some great programs to support children and family, and that's prevention, and that's already under Monroe County's umbrella. Lewis Malone, who used to work at YSB, he's a community advocate, still interested, he's working for Cutters now, but really interested in these projects. And he's very good friends with the guy that wrote the book about Monroe County, when Monroe County was going to build a campus out on the RCA land. He interviewed him within the last year on WFHB. And so Lewis is still very interested in these issues. Building a thriving and compassionate community, Centerstone. Judah Shep is that author of that book. There are links here. We got social workers. We have professors at the university who are interested in partnering. Again, some of those professors are listed here. Allison Howland and Maggie Walsh, that should be Walsh, not Wash, Walsh-Buhai. And Doug Hunsinger from the state, Becky Booner from the state, David Boderoff from the Association of Indiana Counties. We may even have some people here at the next meeting, right?
We're going to ask David Boderoff if he can be here at our next meeting to discuss the new legislation regarding online, whatever.
Yeah.
And also the state's interest in mental health at this time.
Yeah, and so, again, there are some other partners listed here as well who've been contacted, and so there seems to be a lot of interest in collaborating with IU and the county, both IU and the county getting together and collaborating. So so we're excited about this, sort of focus going forward. But is there anybody online Peter, anybody online? Julie, are you still there? I want to make sure I'm not ignoring the people online. Did Julie jump off? Julie, you want to add anything?
No, I'm good. Thank you.
Peter?
Is my audio still working or is it jumping?
What do you say? What was that?
I think it was a question if his audio was working, which it is not.
It's not. Okay. And let me see if I can do this. Hold on. I don't know if I got disconnected again. Let's see. What questions does anybody in this room have?
I don't have questions, but I have thoughts. I think you got to add probation and community corrections to your list. I know they're under the court system, but I think their interests are obviously a little different than the judges. So somebody needs to talk to them at some point in this survey process.
Yeah.
Actually, that's something we wanted to discuss. We weren't sure whether
Oh, I guess I should step
we
on your
should
toes.
deal with them directly or through the courts, or what the preference would be.
I mean, I don't have a preference. I definitely think talk about processes.
Oh,
in
gosh,
place that
yes.
They do, and they have,
Yes.
especially with the pretrial release.
Yeah, which,
That, I don't have this, I mean, I have an
Meeting
understanding of,
rooms
but
and
all
stuff,
of the
yeah.
details of what they would
Yeah.
need at a new facility.
Yeah.
Yeah.
we're probably a little more aware of what's going on with them than what's actually happening in the courts, but certainly we need to talk to them and get a lot of information from them. And as Margie said, YSB, while that's not exactly our focus, I'm sure they can be extremely helpful in many ways, especially, I think, concerning the fact that families are often so relevant, and they've done lots of work with families.
Yeah, and they've got some great training and some education for the public as well.
Yeah.
This I don't want to steal David Bodaroff's show, but this is a presentation that he sent me. Bliss McKnight is an insurer of municipalities, and Lee brought up, the fear of being sued. You have a couple of fears, I think. One, not moving promptly enough or not focusing on the issues, but also not building what's really needed or building the wrong kind of facility. So this is a presentation that they gave at the AIC. And here they say, counties are main portal to the criminal justice system. If you look at Vera Institute, which is a consultant that the county almost hired to do the studies, they say that statistics show that there are fewer people, that more people are being housed in local jails than, states. Sort of the people are getting shoved down to the local level. Mental health and addiction issues are a common characteristic of people caught up in the criminal justice system. As many as 80% of inmates in Indiana jails have drug or mental health issues. Again, if you think about drug or mental health issues as being health issues, one might not want their loved one or their client being put into a correctional center when they really ought to be put into more of a treatment center or a health center. So they give these statistics, and I'm going to skip through some of these and get to the point. They said the courts and jails are being overwhelmed. Jail occupancy is at or beyond design capacity. Inmates are suing counties. The ACLU is bringing civil rights litigation. Federal courts are taking notice, and the media has discovered the problem. So they go through a definition of sociopathy, psychopathy, and drug abuse. It's a disease, affects a person's brain and behavior, leads to the inability to control the use of legal or illegal drugs. Traditional criminals are now outnumbered by people caught up in common mental disorders and drug abuse. The majority of inmates have not been convicted of the offenses that have landed them in our jails. And they go through the pretrial detainees. Growth in pretrial detainees has grown. In 1970, it was 16% of the jail population, and now 65 to 70% of the jail population are pretrial detainees. And I think, Sam, you could attest a lot of the people in our jail do you know right now what the percentage of, or is it 50-50? Is it more than 50-50?
I would say it's probably higher than 50-50. With severe mental health, it's not as high as people that have mental health issues.
Okay. And so,
Sorry,
yeah.
I need to clarify. I thought the question was what percentage are pretrial? But the answer I heard was about mental health. So I just want to make sure I understand.
No, yeah.
I want to make sure I understand the difference. I thought the question was about percentage that are pretrial detainees, and Commander Crowe, I thought your answer was very helpful, but I thought I heard your answer was about mental health in the percentage of detainees. So I want to make sure I just understand.
She's right about the question.
Yeah, I'm not sure of the number of pretrial detainees. I'd have to go and look at that. I'm sorry I got off on, I was trying to follow with that and then you threw me the question. So.
Do you happen to know whether, and I was thinking you were answering the question, but were you, when I said 50-50, would you say it's 50-50 pretrial, or I thought you said it was more than that?
I think it's more than that right now. But I can go and find out and I can get an answer.
I think it's a lot higher than
Yeah.
because we don't sentence people to jail
Right.
much anymore. We don't
Yeah.
say 60, go do 60 days.
Right.
They may sit there for 30 days before their case gets.
Most people are getting out when they're sentenced, it's for time served, because
So
they've already
most
been
of-
in the jail.
Most of the people are pretrial.
Yeah. Yeah, so we have a lot, so the point would be we have a lot of pretrial detainees, and we also seem to have a lot of people with addictions or mental health issues.
And I think we have to be careful when we talk about these stats, because I can't tell from the slideshow. Someone can have they can have mental health issue, but that may not be the reason they committed the offense. So we have to make sure that we're careful when we're talking about those stats, because I can't tell from the slides.
And
I
some might
did not-
argue that just
yeah.
being in the jail gives you a mental health issue.
Yeah. Well, that could be, yeah. And that's honestly, Kate, that's an excellent point. If you read this report, being in jail is itself a traumatic
It's
thing.
traumatic.
And I didn't do these slides, these are Bliss McKnight slides, so I could try to find the answers out for you.
I hate to interrupt with a process thing, but we have 10 minutes left.
Yeah.
And even though we don't have an agenda, the council has received an invoice for your services, and we had stated way long ago that this body has to approve the invoice, and we really have to do it in a timely manner in order to pay you. So if we could do that before 6, that would be
Sure,
fantastic.
absolutely. So we'll make these slides available. We'll make the Bliss McKnight slides available. And Lee, do you have anything else?
Yeah, well, we can send out kind of parameters for the things that we're wanting to learn about. Probably not specific questions, but to give you an idea of what kinds of things we're
Yeah,
hunting
we
for.
really need that, because I gotta tell you, if I ask my office, what do you think the jail needs?
Yeah,
I mean, I'm gonna get, first of all, I might just not get any answers, because it's such a
Big question.
overwhelming
I
question.
understand.
So at least even if it's like about, I don't know, room space or whatever other things you guys think. And we can obviously pick and choose between that. But one quick other note, April and I are both on the board of the Monroe County Bar Association, so we would obviously be happy to solicit both from the civil bar and the criminal bar kind of like their thoughts too whenever we're ready for that. So you just gotta tell us when, and kind of same thing, what you want us to ask. But I think generally, we found in that process that asking more specific questions elicits more feedback. So even if it, yeah.
Yeah, and I guess we need a motion to pay our facilitator.
And I'm sorry, you said there's an invoice? We didn't get an agenda or an invoice, so I was wondering if that's something that could be
I have
circulated?
it. I can
If you-
share my screen if you'd like. It's just
Okay,
that-
why don't you do that? I don't think it was sent to us this time.
Yeah, I'm not sure. It just comes to the council office, and
Yeah, that was really, I think we're going to have to talk to legal about this
our
a bit
legal
more.
said that we had to approve it. Maybe, I mean, maybe they can abstain.
But I think we came up with that plan before we expanded the group.
Yeah,
And-
we did, for
yeah.
sure, but, I mean, I
And
was told
so-
today that legal said that we had to approve it.
I
don't
take
know.
it you don't want to. We can't. Yeah, I think this is something that the commissioners and the council are going to have to do.
That's a separation of powers issue. It's
Yeah.
the judicial branch of government. We don't want to tell you all how to spend your money. We can't.
I guess maybe it was coming more from the point of view of, has the facilitator been doing what this group needs? But I think we're going to have some more discussion about that, but we'll get you paid.
Well, and I don't know if that's a good transition.
Sure.
Yeah, so one of the things that I think is really important is that the county engage with the Center for Collaborative Systems Change. As I mentioned, I had originally said, I'm not a facilitator, I'm a lawyer. I think you need a real facilitator, and I think you need to work with the university. And the beauty of the Center for Collaborative Systems Change is that they can focus on both. And so our contract is a month-by-month contract. And so this will be my last month to be the facilitator. And it's my strong hope by my stepping down that the Center for Collaborative Systems Change will step up, and that the county will feel the need to seriously engage with the Center for Collaborative Systems Change, who I know is super excited to work with the county. And I think they've got the data collection team, they can do the surveys, they got a whole team behind them, and I think it's really gonna be a good thing for the county. And so I talked to Lee about that, and talked to Dave Schilling about it, and said, you know, I think especially, you know, going forward, I think you kind of need this giant university group to really build the infrastructure. We talk a lot in the county about building infrastructure, roads, bridges, streets, but we don't build the infrastructure that's necessary to support the humans. And I think with Lori as a new head of the health department, and really this focus that the state has on treatment and healing people with addiction, and what I'm hearing from the state is going to be coming down the pike in terms of funding. And the Center for Collaborative System Change says they've already got great ideas for grants. And I think that's the direction the county needs to go. And so I will be here at the next meeting, but then wrapping it up. And I've already received last week a message from Allison Howland that said they have a proposal, sort of draft proposal ready. So I'll sort of work with them on what that looks like, and talk with some county and the commissioners and the council about getting that in place. But I feel like I've taken you about as far as I can, and it's really good to have somebody from, you know, the outside who doesn't know y'all, who I think can just step in and lead this, you know, the rest of the way. So, and I think we might even get somebody next month or next week, right? We might even get Allison here, or Maggie.
Yeah. Can you remind me when the next couple meetings are?
Yeah, it's next Monday. So again, this group had decided to meet.
Oh, that's right.
Yeah, you guys had decided to not meet on the 3rd because there was the JRAC meeting. So you decided to meet on the 10th and the 17th. So it's just the meeting on the 17th. We'll not be meeting the rest of the month.
All right, then if no one else has anything else they want to add, we can be adjourned.
Great, thank you guys. Thanks for your. Yeah, thank you.
Yes.
Stop my share.
And Margie is leaving us with a ton of information.
You know, and I was thinking about that. I think I'll just do